Good afternoon, everyone. It's Hanifa Menon from hearthealthbrainhealth.com, encouraging healthy grieving and mindful actions. Today, my quote is by Nelson Mandela. His quote says, "May your choices reflect your hopes, not your fears. May your choices reflect your hopes, not your fears." What a powerful quote, and what a powerful speaker to be sharing it from. Today, I want to talk about our hopes for health because many of you know that I switched from being a licensed naturopathic doctor to being a personal coach for grief recovery and for brain retraining. And there's a lot of reasons that I chose to do this. It was a really big decision for me, and it definitely reflects my hopes of honest communication in healthcare. I also like the idea of empowerment of patients or clients in healthcare. And I'm not sure that a lot of our healthcare system does that in terms of it's part of what society wanted to move towards of Dr. Heal Me, that sort of energy. And certainly a feeling that doctors were trained to feel comfortable with too, because it certainly feeds an ego, but it certainly gives us a sense of purpose too when we're in a position where we can help and we can feel like we've helped, even if it's through a medication or a supplement or herbal recommendation, anything, through acupuncture, anything. If we can say that we've helped a patient, it helps a healthcare provider feel better about their role. It doesn't necessarily help the patient feel empowered. It might help a patient feel really confident about their healthcare provider. Right now, we're in flu season. And guess what is promoted is a flu vaccine. And I can tell you that I've got so many patients, clients, friends that get caught in this time with real unease with whether or not they should get the flu shot. And I can tell you for years I had the flu shot, and one year I had the flu shot, and I had the worst flu of my life. Now, you know, this is one of the side effects that is actually discussed in terms of getting flu vaccinations, that you might possibly get a mild case of a flu, or you might actually get the flu that is the strain that is going around because this particular vaccination might not be the strain that is actually out or that it mutates to by the time it gets to you. And we all kind of know this and we take this in stride most of the time. And of course, there's this whole idea of can we build our own immune system? Because the flu vaccination is not telling us that it's helping our system strengthen, right? There's no obvious, no even implied suggestion that that's what it's doing. Certainly, people are recommended to take care of their health in whatever way, healthy eating, lifestyle, sleep schedules, and then get the flu vaccine because it will protect you. Now, this is what the media will say. This is what health professionals, many will say. And is this acting from a place of fear or hope? So I can understand when someone does anything to help their immune system. I can understand even if there is the hope of, I hope this vaccine helps me prevent getting the flu this year. That's fantastic. If it's, I don't want to get the flu, so I better get the vaccine. And oftentimes that is the message that's given by many doctors. It's also a message that can be given by healthcare practitioners in other fields too, because there can be this idea of you should get this. If you don't want to get a flu vaccine, you should get this instead, and this will help you prevent the flu. Again, if it comes from a hopeful place for the client and or the practitioner, where I hope it does help you prevent the flu, that's beautiful. If it's said with a different energy of you need to do something because otherwise, I mean, the flu's out there and you've got kids and you don't want to get them sick or all of those sorts of ideas, it's really a lot of fear that is in play. I know a few patients that work in hospitals, and every year they are pushed almost mandatory to get flu vaccines. And some of them have weakened immune systems in the first place, and oftentimes this is not the best time to get a vaccine. So it's interesting to me that I think so many times we are caught up in an environment, in a system that promotes something that doesn't really make logical sense, but might make an emotional impact on a person to do something in a particular way, which I don't think is very fair. I really like honest communication. Do you know, a few years ago, there was a news program on, that was when I was actually watching news, and it was really pushing flu vaccinations. And I can tell you by that time, I had my first and only patient who had one of the least positive uh, side effects of a flu vaccination. And it wasn't getting the flu, it was getting a chronic debilitating disease. And in fact, when she told me about it and was certain that it was because of the vaccination, at that time, I didn't even believe it. I couldn't believe it. I could not imagine this sort of reaction happening. This is a lady that used to ride to my office in a Harley. So she would be on a motorcycle to get to my office. And she went from that to needing a wheelchair. And when I looked into it, because she did give me all of the information that she knew, and let me tell you, I did my own research, and that was one of the possible side effects. Now, it might be 0.0001% possibility, but when I look at my patient numbers or my client numbers, and I find that one of my clients has had this result, I wonder why some of these things aren't talked about more publicly. And I do believe that it would create a little bit of public unease, because there is a comfort in thinking that the flu shot is protecting me. And it might be protecting some people, and it probably protects many people. What about the people that it doesn't protect? Do we have to wait till there is an actual concern to actually talk about the possibility? I don't think that's transparency. And I love the idea of transparency. Now we are looking for a COVID vaccine, and we know that there will be something coming up down the road. And I think so many people are really looking forward to this because they're hopeful. They're hopeful that this will create a space where we will be able to go back to old times, so to speak, in terms of being able to walk more comfortably, not having the social distancing, being able to live again the way that we were. And I believe that although nothing will be the same again, there's going to be a lot of fantastic movement forward with or without that vaccine. Now will be the time for people to think about, am I boosting my immune system? I recently learned that a lot of healthcare professionals, allied healthcare professionals, are now no longer really encouraged to even say that they can boost or help boost the immune system. So you understand how much control can be placed on professionals who want to do things to help the public. Now, I do want to make sure that you know that you've always got a choice. You've always got a choice. So make sure that you are not pressured to do something that feels out of your comfort zone because of fear. If you are doing something because of hopefulness and hopeful anticipation of something good, fantastic. That's the space to work from, no matter what you do. But I thought this was a good time to get this video out to you because I care a lot about people's health, and I want you to care about your own health too. Be empowered. Transform your mind and transform your life, and have a great day, everyone. Bye-bye.